Next, I would like to invite Dr. Anujeet Paul. Anujeet is one of our dynamic members of YOC. He is presenting on eyes on Retinai. Over to you, Anujeet. Yeah, it's Retinai or Retina AI?
It's a
Mixture.
play on the word
Mixture.
of AI
Okay.
on retina.
So it's
ATM
not a
it is.
typo, right? Okay.
There. Should I come there? Can you check? So while the technical part is getting sorted, I just want to thank Yossi, Nilesh sir, Digvijay sir, Prasanna sir, the entire GC of Yossi for this incredible opportunity. So, so my topic is to discuss what's happening in the field of AI in retina. But before that, I just would like to share some light on our current concepts of AI and what we are thinking AI to be. So currently, actually artificial intelligence, we are quite far away from it. We are currently in the state of machine learning, deep learning, and I think in the last 6 months, we've gone into generative AI. So what happens in machine learning is that the machine is taught to learn the way a human acts. There are lesser prompts and the machine can respond faster. While in deep learning, there is a feature of raw data which is fed into the machine. The machine takes a lot of time to extract this raw data and formulate its own way of functioning, and therefore data is brought in from that. So currently, everything that we are doing, especially in imaging, especially in glaucoma, especially in retina, is based on machine learning and deep learning and how we can train our machines to work a little bit smarter. So just to summarize, machine learning requires structured data while deep learning does not, but machine learning requires less time and less core functionality of CPU. Digvijay sir was discussing about functionality. So it's deep learning that requires a lot of CPU energy and GPU energy to produce heaps of interpretable data from the data we provide to it. So now the question is, how can all this be used in retina? The easy answer is through images. We can treat or we can get the AI to understand specific features of images, take their features and convert them into a useful output for us. So this has been previously done in small applications as machine learning and it's being currently tried in the platform of deep learning. However, it is very important to note that in the reality, in 2025, the current reality, we are only doing mass screening with AI. Most of our research is tuned towards mass screening, which is actually a good thing because we want to use AI to do the things that humans cannot. There is very little implications right now in electrodiagnosis, genetic diagnosis, as well as diagnostic testing. So what actually is happening in something like this? So the machine is taught by the user itself. The machine marks certain features and the user marks certain features, and the machine is taught to identify certain features in the retina like a hard exudate, a soft exudate, a microaneurysm, and is asked to map these areas. Map it not only in terms of breadth of extent but also in terms of depth of extent, because these features is what the machine can take as binary data to incorporate inside. So this is a slightly complicated image, but if you go with me, I think I'll be able to explain it. So an input retinal image is taken in by the machine, and there is a pre-trained DR grading which is subjected to it. Right in the beginning, the AI is taught to identify for clarity, for field of view, for ability to grade, or to identify any artifacts. If it has passed that, then the AI tries to identify any lesions that may be present. So over here, like I said, the depth of screening as well as the breadth of screening plays a huge role in the screening process. So once it's able to identify that this is a microaneurysm or this is a rod spot or this is a hemorrhage, it starts to segment it. How many of them are there? Are they relatable? Are they coming together? Are they present where I want them to be present? And if at all, can it be confused with something which may be an artifact? Once it does that, the AI is trained to create a grading system depending on what we give as input, the machine perceives as machine learning or deep learning, and the output is extracted. So this is an image that even Prasanna sir showed right in the beginning of his slide. So this is a 3D interpretation of what our retina looks like with multiple A scans. So you can see what the AI is doing is that it's taking all these intraretinal fluid and subretinal fluid as well as exudation and converting it into a binary image that it can pick up, and for our convenience, it is color coding it for us. So fundus image is now currently, through most studies, passed through deep learning. Deep learning algorithms are trying to pick up certain features of the retina and are trying to put it in a certain way in which it can be interpreted not only by the system, but an output that can be interpreted by humans. So coming back to this image that I had shown you right in the first part of our slide, we are currently trying to create segmentation based on OCT as well as clinical fundus photos. We are trying to identify fluid, the fovea, vessels, microaneurysms, hyperreflective membranes, other OCT biomarkers, as well as drusen's and hemorrhages. So as we are getting better, I will come to some studies and some research work that has tried to put this into application. But the idea in retina, as well as in glaucoma, is to identify these key features and bring them and predict certain features based on demographic data, clinical data, to predict disease outcome as well as progression. So this was a study that was done to check whether we can actually predict the same results that an individual retina specialist is doing by clinical examination or by the OCT. So you can see that current research in terms of screening has become quite good in identifying features and biomarkers in terms of retina and subretinal lesions and areas. This is a representation of macular edema and certain spots. So like I said, that it tries to identify areas of membranes, areas of fluid, and then tries to map it according to time. On the right-hand side, you can see that over a number of months, it is trying to measure the size and the depth of a geographic atrophy, which is increasing in size over time. This is through repeated examinations of the fundus. These are some AI images of the AI trying to measure drusen and the confluencity of drusen, whether we can predict an algorithm for this patient to develop geographic atrophy or not. So that was the application of AI and the research involved and the concepts that we are currently thinking when we are trying to implement AI. So there are about 2 or 3 places in which AI has actually reached the clinical spectrum where we are actually using AI. So one example that I had found is Retinai AI. So this basically works on fluid segmentation, layer segmentation, as well as advanced screening in terms of biomarkers. So if you put an OCT report through this Retinai AI system, it is available online and this is also FDA approved. It gives you a breakup of the OCT image. It tries to find out the volume of IRF, SRF, PED, subfoveal thickness, etc., and give you a fluid status report. Whether it is able to interpret this report correctly is the challenging part. We have already crossed the stage where it can actually predict the report correctly. So this is a retinal layer report showing the mean thickness in different layers. Once again, the mean thickness in different layers is quite easy to predict because we are already doing that with OCT and Octa. We do it by manual segmentation. The AI sometimes gets it wrong in automatic and sometimes gets it right. It's whether it can interpret this data and give us a valuable prognostic or diagnostic information is important. So IDR-DX eye diagnosis is another example. So this is the closest that we have in terms of interpreting which is available in the commercial market. So this is mainly involving an OCT machine and the output data is put in a retinal algorithm, and since it is employing machine learning and not deep learning, it takes less than 60 seconds to give you an output in terms of what the data is. We can perceive the output in terms of whether it is referable diabetic retinopathy or non-referable diabetic retinopathy. So there was a small portion about black box in AI. So black box in AI is also something that we need to be aware about. This is something that is coming as a slight disadvantage to us. So there are many cases in which we put in an input algorithm, we have trained the machine to search for certain features, but the output algorithm is something that the machine gets totally wrong, or the machine gets right, but we do not know how the machine is doing it. For example, we are seeing hard exudates and soft exudates, but the machine is training or trying to predict this as something maybe as a PDR or an advanced diabetic eye disease, whereas the normal case, it would just be an NPDR. So this is where the transparency or the interpretability of AI algorithm is lacking, and we do not know which algorithm the AI is using in spite of training the AI to use the correct algorithms. So this is a sort of a flip a coin sort of a scenario that we are also trying to figure out. So what are the future directions that we can go for? So what are we looking for? The dream is to have an AI doctor, so that, like we have been discussing, to do mass screenings for us and only refer the cases that need human intervention, because as humans we are lacking the ability to go to the periphery and screen patients. So how close are we to an AI doctor? The AI doctor is able to currently classify the disease, break down the disease, identify features, but is not able to correctly interpret whether it is referable or non-referable diabetic retinopathy, treatable or non-treatable neovascular AMD, etc. We are hoping for a future in which the results that we get out of AI can smoothen and decrease the burden in terms of retina specialists and doctors, where the AI can differentiate different phases of fundus fluorescein angiogram and give us interpretable results. Thank you.
Great presentation, Dr. Anujeet. So one thing I wanted to ask you is the Retinai which you showed. So we can upload any OCT image and then it will give the values.
So Retina AI has a fluid segmentation application that it is launching.
Yeah.
It is available in the US. So if you click country as anything outside the US, you're not being able to download it. But fluid segmentation is coming as an application. It will use machine learning, and anyone can upload a photo. And IDXDR is also giving that in terms of a physical model as a software plugin for TopCon OCTs and etc.
So that'll be just basically one line scan which you can
One
upload.
line scan, you upload, and you get an interpretation whether this needs to be treated or not, so that the machine can be taken where retina specialists cannot go or ophthalmologists cannot go.
Okay.
I think one of the things also that we're working on with one of my co-founders in another company is where we're looking at a comprehensive AI situation where you take a picture, then it'll also tell you about glaucoma, about diabetes, stroke analysis, cataract, all in kind of one go. Because right now everything is happening in certain segments.
It's two segmented.
But that itself actually is it's very difficult to integrate that, because each thing is being looked at separately. So that does take a lot more time to process. But ultimately, the difference is that when as a doctor we look at a patient, we look at everything from the front to the back, right? He's got a shallow AC, he's probably got a cataract, retina looks like this, let's do this. That I think will take a lot more time to come. But these piecemeal things will definitely...
Yes, I think because of purely imaging, glaucoma and retina has taken a forefront in AI, but the other departments are not far back. But once we get a segmented model in all of this, I really hope so what you're saying and your friends who are doing it, they are able to do it, because that's actually the need of the hour.
Good, thank you.
As Digvijay sir pointed out, Anujeet, even in glaucoma, the multimodal AI that we call incorporating a visual field with the OCT, with the AIOS2025, even with the CCT, can we develop an ultimate calculator? Once we image a patient, we get everything, the risk profiling. So that is, I think, the future.
So do you think, sir, we are close to some sort of an AI index for glaucoma where we can, are we working towards that?
We are trying to work towards
Yes.
it. Like, for example, the octopus has this polar analysis,
Yes.
which gives an idea about how the disc looks. And the cluster analysis is more like how the RNFL damage is. So we are trying to navigate one tool at least. I am part of one project. But I think we are still a long way to go.
Yeah.
But that's what sir rightly pointed out. That's the future.
Because there's such a lot of heterogeneity. Particularly, I mean, you show the same thing to 3 glaucoma specialists, and all 3 may actually have different values about it. So where the ground truths have gray areas, in diabetic retinopathy or something, that's why it kind of did better, because these tools, because a microaneurysm is a microaneurysm, right? At the end of the day, but a glaucomatous disc may or may not be
progress.
glaucoma.
It has a dynamic.
So it's kind of different in that sense. Even though it's a much bigger, probably an easier thing to segment, but that's kind of where the challenge comes. I think that, I mean, it's just going to be a matter of time, but it will ultimately have to happen, because that's how you see. How does the AN and the artificial neural networks, how they work and how do the human brains work till they're actually able to simulate that? That's only going to happen when we look at each parameter and not one parameter alone.
Yes,
So right now we're still in
absolutely.
that one parameter stage.
Just to add one last line for the audience who's listening. So, sir, Shishir sir, you had asked me about a single image. So right now we can even upload a single image to ChatGPT as well as Perplexity, and it gives us reasonable results. Sometimes it goes very haywire, but nowadays if you upload maybe a CSR or something, it will give you reasonable results on the interpretation, etc. So I think that is a very good step going forward that has come out.